I'm Dr. Dan Rukeyser. Today we're going to cover some common problem areas on thrivalmusclerecovery.com. Welcome back. Today we're going to talk about the muscles of the low back and specifically the muscles that are involved in low back pain. We often get questions, hey, where's the QL? How do I find it? And how do I treat it? So first, let's find it. The QL is a muscle that runs between the pelvis and the ribs on both sides of the spine. So it's like a little square right in through here. And it's bordered on one side by the erector spinae muscle, the spine itself, the pelvis, and the ribs. So when you treat it, you're going to always want to make sure that you're not pushing on the bone of the pelvis or the ribs or the spine. Moving medially or towards the spine from the QL, we've got the erector spinae group. This is a very, very important muscle in extension of the spine. It also acts a lot in low back pain. Below that, we've got the multifidus muscle, which is one of the most important muscles in low back pain. First of all, it hurts, it tightens up, and the big problem with the multifidus muscle is that it starts to degenerate over time. It gets smaller and smaller and weaker the longer you have low back pain. And so this is why we often see people who have low back pain over and over again in their life. Unfortunately, low back pain over a long period of time causes changes in the muscle, and those changes end up causing more low back pain. So it's extremely important to do your recovery, do your own treatment, recover from low back pain, and re-strengthen these muscles that we're talking about today. We've covered the QL, or the Quadratus Lumborum. We've covered the erector spinae muscle. We've covered the multifidus. Now, let's talk about the relationship between the psoas muscle and the QL. What we've got is really not a lot of space here in between those muscles. If you'll turn to the side, you'll see the psoas muscle, it runs right in through here. And as far as the back QL goes, we've only got really a little bit of space in between here. What tends to happen, especially in people who are sitting often, we'll get this shortening of the psoas muscle, and that tends to bring the spine forward towards the hip. Well, once you're in that position and trying to walk around, you tend to lift up, and that creates this situation where you're sort of upright, but everybody would recognize this as a low back position. And the reason is because the psoas muscle shortened and the low back muscles in the backside are working super hard to keep him upright. So from here, it's very easy to see really how close the psoas and the QL muscles are to each other. I mean, my fingertips are nearly touching, and I'm on the psoas muscle on the front and the QL on the back. It's really just a couple of inches. So I hope that clears up where to find the low back muscles. You can begin to treat them each individually, knowing better where they are. For more videos on finding muscles, for treating the QL, go to thrivalmusclerecovery.com and check us out.